Hello, everyone. I'm Tina Cosby with WTLC AM 1310 and 95.1 FM. And today we are here with the reminder that we are smack dab in the middle of the cold, flu, and COVID season. And together with our friends at Eskenazi Health, we want to get you prepared. Joining us now from Eskenazi Health is Dr. Amy Kressel, who specializes in infectious diseases. Dr. Kressel, welcome. How are you today? It's good to talk with you again.
I'm good, and I'm trying to keep warm.
Yeah, that has been a challenge, but it's December in Indiana, so I guess we should welcome that. So, but we are right here where we say that it's time to pay attention, although a lot of times we say it's time to pay attention heading into the season. So does it matter when you start your vaccinations and things of that nature for cold, flu, and COVID?
Right. So I think that flu and RSV, because remember, we do have a new RSV vaccine that came out last year. They're a little more predictable. They usually start showing up around October, and they seem to have settled into their usual season. So we recommend people start getting their vaccines in September to make sure you're protected for when those viruses come. COVID is a little less predictable. This past year, we had a peak in late August, early September, and then it dropped. And it's not, there's not a lot of COVID around, but it is around, and it does seem to be slowly rising again. So that one is a little harder. I did personally get my vaccines in September, both COVID and influenza, because that's when the new ones were available. Yeah. But I don't think it hurts you to get COVID. When you get flu, it's probably easier. You just get 2 shots at the same time, and you don't have to worry about it.
You know, there are so many different schools of thought about that, because one of my doctors told me, well, Tina, it'd be a good idea not to get them at the same time, because I got my COVID and flu as well. And I said, well, why not? I can get it. They said, well, if you happen to have a reaction to one of them, then we won't know which one it is. So do one first, then do the other. A few days later, even, give it 3 days. Different philosophies, different schools of thought. Is that?
Yeah. And people have their preferences. I don't think it's critically important as long as you get them. Yes. So if you are of the mind that, the side effects are minor in the big scheme of things, but I do personally get a sore arm. I sometimes feel really achy from the vaccines. And people might want to spread it out and not have both at the same time. I did not notice an appreciable difference personally in those minor side effects getting both at the same time, but people are different. Yes. I really think it's just, you have to know yourself. Are you going to be concerned about getting both at the same time? Or are you going to forget to get the second one, right?
Yeah, exactly. That was my concern. And I did it. This was the first time I did it that way, but it's like, I don't think that there's that big of a problem. Yeah. I did it 3 days later. Although I did have 3 or 4 days later, I did have, like you were saying, a little bit of sore arm or thing. But I want to talk about the third player here, RSV. Share with us a little bit more about that.
So RSV is a seasonal player. It usually occurs during what we call flu season. Things got scrambled a bit during the pandemic, but I think everything is settled to their quote unquote usual seasonal patterns. And RSV has always been a concern for infants, but because we couldn't do much about it, it wasn't as well studied as influenza. But some exciting things happened last year. One is that we got an RSV vaccine for adults. And 2, we got a better monoclonal antibody for infants. So RSV is a virus that is more severe for infants in their first year of life and for people who are older. So a little bit like COVID, except that you've got that risk to infants. And it is the leading cause of hospitalization for infants. So it's pretty serious. And in the past, there were measures for high-risk infants, but they had to get 5 injections of this monoclonal antibody. So the new monoclonal antibody is for all infants because because about half of infants who actually get hospitalized with RSV have no known risk factor. So we know risk factors and we know some infants are higher risk, but still, even seemingly healthy infants can get sick with this. So this new monoclonal is only one dose and you're good for the year.
So do infants or young children get these at their regular checkups with their pediatricians? I mean, or do you have to request it specifically?
I think you should ask your pediatric practice how they do it. We would give it here at Eskenazi routinely. So if you're born during respiratory virus season, we would give it to you here at Eskenazi before the baby goes home. And babies born earlier in the year would get it as they enter respiratory virus season.
So what's the age range for? You say infants. What's that age?
Yeah, so it's first year of life, and then for high-risk infants, also second year of life.
So toddlers?
No, once they're more than 2 years old, they would be out of that risk range.
Okay, I see. And so the risk range for adults in the adult world regarding RSV, because there's an RSV vaccine that was on there were a whole bunch of vaccines on the list when I went to get my COVID and flu, and I'm like, oh, let me start with the main ones here, and then the others. But what adults are we talking to as far as RSV vaccine?
So for adults, again, this is a new vaccine, so they actually revised some of the guidance. So first of all, pregnant women in the late part of pregnancy, so shortly, not too close to birth, but like 4 to 6 weeks before giving birth, you could get this vaccine. Pregnant women themselves are not at risk, but the idea is you're protecting your infant. So by vaccinating yourself, you're giving your baby those antibodies. Then anybody between age 60 to 74 who's at high risk of severe RSV. So we're actually, again, learning more about who's at risk. So anybody with heart disease, anybody with lung disease, actually anybody with kidney failure is also at increased risk of severe RSV. And anybody who's immunocompromised could get this vaccine if you're in that age 60 to 74 window. And then for anybody 75 and above, though anybody at that age range, regardless of other risk factors, can get the RSV vaccine.
Yeah. So the RSV, you said it's exciting, and I guess people should find out and learn more about it and learn what your risks are. What about COVID that took us out of circulation in the world just a few years ago? What's the status there? What's the picture?
So COVID is a regular player now. It is not going to go away. As I said earlier, it is here now. So it might, I still don't know what its pattern is going to be seasonally. This might be something that occurs in 2 waves a year. I really don't know. And just like for influenza, we get annual vaccines. It's recommended that for COVID, everybody get at least one annual vaccine. People who are immunocompromised are recommended to get 2 vaccines. So, not of course right together, but, roughly 6 months apart. But that's the recommendation for immunocompromised people. So yeah, the vaccine immunity doesn't last a full year. And because COVID's here all year round, that's the recommendation for immunocompromised people. So I think we're still going to learn more about that vaccine. And just like for influenza, COVID vaccines get updated regularly. So they look at what's going around for both influenza and COVID, and they try to formulate the vaccines to what's circulating.
So when the vaccines for COVID were initially and first made available, there was a lot of confusion surrounding the vaccination, then the booster, then the timing between all that. Has much of that been simplified now to the point where you got yours, I got mine, we don't have to get any more until next season, or should we boost that? Or what are the guidelines for that as far as?
Right. So I think unfortunately the nomenclature for COVID was a little bit different than influenza. And I personally am trying to normalize it. So I know for influenza, I get my vaccine once a year.
Okay.
And there's little benefit. I mean, it's not recommended to get multiple influenza vaccines a year because the formulation doesn't change. But every fall, there's a new formulation of influenza vaccine because the virus keeps mutating and strains emerge and mutate slightly. So they look at what's going on in South America, in the Southern Hemisphere, because that predicts what we're going to see here. And they reformulate the vaccine. And something similar is happening with COVID now. COVID keeps evolving and there are new strains. So the vaccine that came out around September for COVID was a reformulated vaccine. So there was benefit to getting that to get a vaccine active against the variants. What's a little bit different about COVID is for immunocompromised people, they are recommending a second dose, even if the vaccine's not been reformulated.
Okay. So Dr. Kressel, what are the guidelines for getting us through the rest of this flu, COVID, and RSV season, the triplets, the triad, as you said? What are the guidelines? What should we do?
Right. So I think one thing is I like the term respiratory etiquette. So if you cough or sneeze, you could wear, if you think you have something going on, you can wear a mask to protect others. You can cover your cough. You can wash your hands. Some of these viruses, if you sneeze in your hand, you could spread it to somebody else just by hands. So I do carry a little bit of alcohol, hand hygiene with me. And if I forget and I sneeze in my hand, which I still do, I can quickly use alcohol to clean my hand. We tell people to cough in the elbow, but a lifetime of habits of coughing in your hand are kind of hard to break. And I think you can be really considerate of others and stay home when you're sick.
Please say that again, because how many of us have been in the workplace and our fellow employees and colleagues are dragging, hacking and everything? It's like, what are you doing? Right. Did COVID teach us nothing?
Yes. We talk about presenteeism, right? Don't come to work sick. Now, I know, I realize that's easier said than done for people who don't have sick days and have jobs where they're living hand to mouth. So if you have to go to work, if you don't have a job that lets you work remotely and you just cannot take those sick days because your family needs your paycheck, then wear a mask at least. Yeah. I think we've talked about this before. I'm really situational with my mask these days. I don't wear it all the time, but if I'm going to a really crowded venue, I'll wear it. When I'm seeing patients, I wear it. I always wear it seeing patients. If I have a travel plan coming up, a big trip coming up, and I don't want to get sick before the trip, I wear my mask. And people have to do what's right for them. If you're immunocompromised, I think you should wear your mask when you're in public. I would do that to protect myself if I was in that situation.
What about public transit, like bus, train, planes, and maybe other? I don't know. Is it still a good idea to mask up because it's a lot of people in a closed environment, or I guess it's subjective?
It's subjective, but I personally do it. Yeah. And in the airport lounge also.
Oh, okay.
Yeah. So I finally got COVID in February.
Oh, I'm sorry.
No, it's fine. I was very fortunate that I got it after I was vaccinated, right? 4 years after it came, I was fully vaccinated. And so my COVID was very different than the people who got it in early 2020.
Did you use Paxlovid?
I did not, interestingly. There's a long story behind that, but I didn't really meet the risk profile. But my husband took Paxlovid, actually.
Yeah, and Paxlovid, for those who are listening and are watching who may not know, explain what Paxlovid.
Yes, so Paxlovid is an oral antiviral for COVID. Not everybody needs to take it, but it's recommended for people who are at increased risk of severe COVID. And even though we have vaccines and and COVID is very different now, right? Now that we have population immunity, and perhaps the virus has changed as well. it's very different, but there are still people who can be hospitalized and get sick. There are still people who can get long COVID. So if you are older or if you have other risk factors, it is recommended to take it. There are recent studies that show it is still effective in preventing bad outcomes in people who get COVID. So there's still use for it. And the higher your risk of getting severe COVID, the greater the impact of Paxlovid, right?
So know your risk and then ask for, but Paxlovid is still out there and is still being used in cases where it's needed, I would assume. Yeah.
Yes. So it's there. And the other thing is, let's not forget that we have Tamiflu or oseltamivir for influenza.
Yeah.
So it's the same thing, right? If you're at risk of severe influenza, you can benefit from getting Tamiflu. I am using the brand name. And
by prescription, right?
By prescription, yes.
Both. Okay. Tamiflu and Paxlovid are both by prescription. Okay. So, but they're both effective, right?
Yes. I mean, nothing's going to be 100% effective, right? We talk about not getting rid of all symptoms, but preventing that progression to severe disease.
So I want to circle back. I interrupted you. I'm sorry, but
you're fine.
But you were talking about you caught it, and luckily you didn't have as severe a case. But you were uncomfortable for a few days?
Yeah. So I probably was uncomfortable for 5 days. I had fever for 1 or 2 days. I had a cough. And I just felt really tired. I had difficulty walking upstairs for a few weeks, but I fully recovered.
Yeah. So Dr. Kressel, again, as we look at the evolution of the guidelines, and this is what you should do if you have COVID or if you test positive for COVID. It started out staying home or staying away from people 10 days. Then it went to 5. What are the latest, most recent guidelines for if you test positive for COVID? What should you do? Should you stay in, stay home? What is it? What's the latest?
Yeah, so CDC changed their guidance. And for healthcare workers listening, these guidance do not apply to us. We have a whole different set of rules for healthcare workers. Yeah, okay. Our rules are a little more stringent, but for the general public, they talk about staying home for at least 2 days until you're fully recovered. They basically are asking you to follow your symptoms. If you have a fever or ongoing cough, stay home.
It seems like it was a lot more, from what I recall. And I mean, it had loosened quite a bit. And as you were saying, I loved what you said, follow your symptoms, because everyone knows with a fever, you just don't.
Right.
But the 5 to 10 days staying at home and isolating for 5 to 10 days, that is no longer the guidance from the CDC, correct?
Right. It's not a strict 10-day guidance anymore.
Okay. Yeah.
They might say something about 5 days, but they've said the website, I believe the last time I looked at the website, and I admit this was several months ago, it was more that you should stay home until you're fully recovered.
Until you're fully recovered. Now,
I think they still say to wear a mask for 5 days.
Yeah.
I think that is still in there, that even after you feel better, when you go out and about, you should wear your mask.
Yeah. And, the interesting thing is I had COVID twice. One case was very miserable. The other time, I didn't even realize I had it. I stayed in for 3 days, but never really ran a fever, but kept masking anyway. Even when everything was gone, I masked for another week or so after I was fine and no longer tested positive. That was just me. But is it unusual to have it and not have? Because I couldn't believe that I had tested positive for it because I had no symptoms. And I guess if I think about any symptom that I may have had, I was tired. But that's a natural state of being for me. We just do a lot of things. So I said, oh, wow, maybe that was it. Maybe I was more tired than I thought. So I guess the guidance there is if you think you may have been exposed. But again, I had no idea that I had it. I did know somebody that did have it. And I said, oh, let me just double check. And I did. I was positive, but never sick.
Yeah. So Even at the beginning of the pandemic, there were people who had almost no symptoms or no symptoms, right?
Yes, yes. Okay.
And we talk about influenza, for example, feeling like you're run over by a train, right?
Uh-huh.
But even with influenza, yes, the typical influenza is fever, body aches, maybe a cough. But I had influenza once. I had laryngitis. That was it. I had nothing else. I felt great. I just couldn't talk. So even with influenza, there have always been people who have a much milder illness. And it's really hard to know like what you have.
Yeah. Yeah. Well, both of my testing positive were behind vaccines because I've always been fully vaccinated. So I think that helped a lot. So influenza, we've talked about RSV, we've talked about COVID. What is your guideline for influenza? And since all of them tend to overlap a little, I guess, how do you know one from the other?
There's huge overlap. So even I would not be able to tell with my symptoms what I have. Like usually a common cold will start with a sore throat and then very quickly you have that really runny nose. And you may feel miserable from that, maybe some tiredness, but most people don't have a fever. I can't even say everybody, right?
Right.
But some people can get sinusitis from the common cold. So there's a huge overlap of symptoms, but usually you're not going to have a fever. With COVID, it's more fever, cough. With RSV, it's cough, influenza, fever, body aches, but there's huge overlap with the symptoms in all of these things. So it's really hard to know. There's still home tests for COVID. The government is still actually restarted their distribution program. So you can, I forget that. I think it's covidtests.gov or something like that. There's a website.
Exactly. I was going to, you know why? Because I say it every day, just about every day on my radio show, covidtests.gov.
Yes. So it's COVID.
Yeah.
Yeah. covidtests.gov. You can get, every household can get 4 tests. So I got mine. So the home testing is still available. I think there's a home test for influenza. I haven't seen it around.
Oh, I've never seen one of those. Yeah.
I think there is one now.
Okay.
Yeah, I believe so, but I have not seen it in a drugstore. So I don't know how widely available that is.
What about a home test for RSV?
Not that I know of, no.
Not that you know, okay. But no, and speaking of home testing, can you clear up some of the confusion about the CDC extending the expiration dates of some of the COVID test kits, making them still good? Because I had a friend who had about 20 and she saw that it was expired and she threw all 20 boxes out, which was 40 tests.
Yeah, we just ran through ours. So they did extend a lot of the test dates because they retested them and they found they still worked. So what you do is you just, again, I don't know the specific website, but if you type like FDA COVID test expiration in your web browser, you should be able to pull up the site where you can check your lot numbers.
Are the lot numbers on the CDC site? I would suspect that they would be.
They are on FDA site. So I would just,
okay. Yeah.
It's FDA. I always just type FDA COVID test expiration.
Oh, wonderful.
And I can find, it takes me pretty quickly to the right website. And then you find the manufacturer of your COVID test and you type in the lot number. So yeah, we actually, all of ours are expired now for real. Not the ones we just got, but all the ones we got during the pandemic are truly expired. But there might still be some out there that work. By the way, I just looked, CVS has the COVID flu test. So it's called, it's a combination COVID influenza home rapid test kit. It happens, I happen to find it on the CVS website. It's $25. So yeah, and I'm not saying that you have to buy it from CVS. I'm sorry, I don't. But I just
I understand
that right now.
I understand. Yeah, and so CVS, yeah, but the governments seem better because they're free.
Yes, but the government is only COVID, but it is free. There is something to be said for free.
My favorite 4-letter word, so I always say that. But it's not COVID. I mean, it's not influenza. It's just strictly COVID.
Yes.
Do you know how, I guess that's been up for a minute though, because we've been sharing that with our listeners. So that site's been up for a minute.
I believe it started September, right? September or October, something like that.
So here in the central Indiana area, we were lagging behind the nation in terms of COVID vaccinations and things of that nature. Have we caught up? Have we normalized? And are we pretty good now?
So in Indiana, almost 3.9 million people have gotten at least one COVID vaccine.
Mm-hmm.
And almost a million, so a smaller number for sure, are up to date.
Wow.
Yeah.
That's a whole lot better than where we started.
It is better. And no questions, the pandemic has changed.
Mm-hmm. Okay. Yeah, indeed. So it's changed a lot. So as we prepare to wrap up, Dr. Kressel, is there anything that you want to, make sure that we know about or share before we have to wrap things up?
Another thing is there's actually a new pneumonia vaccine for adults.
Oh, okay.
Yeah, it's a new formulation. It's a pneumonia vaccine particularly formulated for adults. And it's recommended anybody age 50 and above should get it. So that's also new because, we used to vaccinate people who are much older or people with risk factors.
It's all new. There's a reason we do these seminars here because it's all new information. Thank you for that. That's great.
Yes.
Adults 50 and over, new pneumonia.
Yes.
So that new pneumonia. So Dr. Kressel, if people watching now want to know more about this and anything we discussed, what is your website?
It is eskenazihealth.edu. There's information about our doctors, our clinics, and general information.
Okay. All righty. Well, thank you, Dr. Amy Kressel. We really appreciate it. And hey, we want everybody to stay healthy this winter. So please get the information. It's free online, eskenazihealth.edu, and take care of yourselves out there.
Thank you, everybody.